in the intense world of medical emergencies.
One patient, 3 times stab wounds.
There's nothing more extreme than a code red.
This is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, highly specialist teams are ready to react to these major traumas.
PTO 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
This is going to be tight and painful, okay, but it's going to save your life.
Day and night.
All right, well done.
From car crashes to stabbings.
He's been hit and stabbed in the head.
Here, where time is critical, lives will be saved.
Everyone clear?
Shocking.
Yep.
These emergency doctors and specialist paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
I suspect we are going to be cracking open the blood products en route.
Filmed alongside the critical care teams, we captured every vital second as these specialist crews work to save lives.
1, 2, 3, roll.
Tonight, reports of a stabbing as a house party gets out of hand.
But it is going through to like fat layer underneath. Because it's penetrating, it's in an area that potentially there's some blood vessels in it.
It looks fairly clotted, doesn't it?
Have you got another pad?
Concerns about heavy blood loss for a patient who's fallen badly at home.
It's bleeding a lot.
I know, that's a lot. It's just constant. Do you remember what happened?
Yes, a truck came towards me.
A man is trapped after a car and tractor collide.
Have you got any pain anywhere?
And a desperate late-night hunt for a man feared drowned in a river.
Sounds like he was intoxicated, so the likelihood of him being able to hold his head above the water is slim.
At RAF Cosford, the Midlands Air Ambulance team are starting their shift.
Right then, so today it's a nice weather day. General synopsis is high pressure dominating the UK, and it's going to
Calm weather conditions are good news for the team. Each helicopter is crewed by a pilot, a doctor and a critical care paramedic.
We have checks that are done daily, and then you can just sit tight and rest easy really before a job comes in.
Karen Baker has been a critical care paramedic for 11 years.
It was always my dream really, was to be permanently based here. So yeah, happy bunny really. It's a great job, love it.
The air ambulance team covers 6,000 square miles, responding to some of the most traumatic incidents, including cardiac arrests, road traffic collisions and major injuries. When every second counts, the aircraft has the ability to get to patients within 15 minutes.
Ambulance services, patient breathing.
Yeah, this has been a big accident.
Oh, God. There's tractors, there's lorries. So I just watched a white car fly down the road. He was probably doing 90. And he was kind of running off the road. He'd hit another vehicle and flipped over. Okay, so an ambulance is being arranged. You're probably going to need all services.
Currently getting reports of a car 90 mile an hour speed
4 minutes.
with crew patients trapped. Received that.
Yeah, that's all received. It looks like we'll be overhead in about 4 minutes, over.
Police, fire and ambulance are all on their way, and specialist trauma backup has been requested. Joining Karen is critical care doctor Hannah Borden.
If it really is 90 miles per hour, that increases the risk of significant injury. Traffic looks like it's stacking up.
Yeah.
Yeah, it looks like traffic stopped there. 03 on the ground.
Arriving on scene, the critical care team discovered that the car has collided head-on with a tractor and flipped over, trapping the driver.
What we got?
Normally fitting well.
Yeah.
No previous medical history. He's got a good recollection of what happened. Basically, in his words, the tractor pulled out.
The force of the impact is clearly visible at the front of the vehicle. A passerby has crawled inside and is supporting the man's neck while firefighters secure the car. Karen takes her helmet off to gain access to the patient.
Right, what's your name, fella? Well, the patient, aren't you? Can we not vape? Is that all right?
Oh, yes.
If you don't mind. I'm Karen, by the way. I'm off the air ambulance. Do you remember what happened?
Yes, a tractor came towards me.
It's unusual for a patient trapped after a major RTC to want to vape in the wreckage rather than get out of the vehicle.
Has he got any injuries, Cab? He's acting quite weird. He was vaping in the vehicle and he seems a bit distant.
I'm not deaf now.
So, I know. I'm going to hand over.
Right.
To Karen, the man appears almost too calm and too direct in his answers.
So, have you got any pain anywhere?
No.
Not at all?
No.
Although the man's behaviour is concerning Karen and Dr. Hannah, they can't assess him properly until he's out of the car.
Are you stuck by your legs? I'm talking to you. You're the patient.
Yeah, I'm all fine.
Do they feel trapped under the steering wheel?
No.
Okay.
As the crews figure out how to free the driver, Dr. Hannah has another concern that may explain his strange behaviour.
I think that he's been drinking. Yeah, I think so. That's why he's acting strangely. Yeah.
Ambulance service, is the patient breathing?
Yeah, but he's cracked his head open, there's blood everywhere.
Is he conscious?
Yes, he's conscious.
Will you be able to speak to me at all?
Hello?
Have you fallen?
Yes.
Can I speak, please?
I'll put more on phone.
He's just fell off the step.
Fell off the step, okay. Can you see the blood spraying out?
There's a great big puddle. I don't know how much.
It's a lot.
As the patient may require urgent trauma treatment, the incident is passed to critical care paramedic Kerry Penn-Ashman and Dr. Matt Rowley.
We're going to a 62-year-old. He's got a large scalp wound with significant bleeding. So we'll see, it may be that he's nicked an artery.
With elderly patients, there's always an increased risk of severe brain injury following a trauma to the head. At the scene, an ambulance crew is already treating the patient.
Hello.
Guys, so this is Terry. He's 62 years old. About 20 to 7 this evening. He's had a fall down about 4 or 5 stairs. Yeah. Fallen backwards. We think he's hit his head on the wall. Only injury is to the back of the head. It's bled through 3 dressings as of now.
Yeah, okay.
We can't really see sort of where it's bleeding from.
Terry was going to bed for a nap when he missed the handrail, fell backwards down the stairs and hit his head on a table. His injury has caused a serious bleed.
Okay, is it dripping anywhere?
Yeah.
So just let me hold your head. That's it.
Okay.
It all looks fairly clotted, doesn't it now?
Have you got another
big one.
pad? And then we'll put another pad on just to see what comes off after that.
Matt examines Terry's injuries to determine what treatment to give on scene.
He's bleeding a lot.
I know, that's a lot. It's just constant.
Or with such excessive blood loss, he may need immediate hospital care.
Yeah, he's dripping quite a lot actually, isn't it, underneath at the back?
He's got 2 stab wounds to his lower back.
The critical care team deal with more than 30 stabbings every week.
Let me just see if there's any blood in your mouth. Open your mouth wide.
Reducing the number of deaths is one of their main objectives, but it's a continuous battle.
A lot of people think that a knife doesn't do as much damage as a gun, so they think, I just made a little hole, what's the problem? Well, you've just killed them because of a little hole.
In 2019, the West Midlands recorded the second highest number of knife crime offences outside of London.
He's still bleeding past my hand, so I need to get a grip on where that's coming from.
Stab victims are time critical, as they can bleed to death in a matter of minutes.
A lot of them are very young. It does get slightly harder once you start doing the kids. We just probably have to be a bit more emotionally tougher to deal with it.
Ambulance here. The patient breathing?
Yeah, breathing. Someone's got cut real bad.
Where is the bleeding from?
The back, the bottom of the back.
Have they been stabbed?
I think so.
Does it look like a heavy bleed?
It's bad, not gonna lie. So basically you can see bone. It's deep.
We're coming as quickly as we can.
Stabbings can cause catastrophic injuries, so are code red emergencies. Critical care paramedic Dan Fletcher and Dr. Matthew Stewport are immediately dispatched.
98, thank you. Just confirmation, please add on route, but not yet on scene, okay? Still querying where the offender is, but just trying to get that information.
So you just got reports, by the sounds of it, of a single patient with a stab wound to the back and quite a bit of blood loss.
Severe blood loss can lead to cardiac arrest, and the knife could have damaged the spinal cord, causing paralysis.
We were literally within a stone's throw of the major trauma centre in Birmingham, so my priority is to get him to hospital in a safe and expedient fashion and to not delay on scene.
With the whereabouts of the attacker unknown, the critical care team will need police to declare the scene safe before they can approach.
Is there any confirmation of police on scene, over?
98, that's the negative for this point.
Right, one casualty in this car, so he's the priority.
In Shrewsbury, critical care paramedic Karen Baker and Dr. Hannah Borden are at the scene of a serious crash. A car has been in a head-on collision with a tractor. The driver is trapped inside.
Acting quite strange, appears to be drunk. That is an assumption at this stage.
It's possible shock from being involved in the crash and alcohol could be masking serious internal injuries.
Hiya, my name's Hannah, I'm one of the ambulance doctors.
Oh,
Right,
hello.
hi. We're just trying to work out how's sort of safest and quickest to get you out of here, really.
It's important to get the man out as soon as possible. Karen carries out a quick assessment to establish if he can get out of the car by himself. Only then we should be able to fully examine him.
What I'm going to do is I'm just going to have a little prod of your neck. And then if all that is okay, I'm going to try and push this seat back and see if we can get you to crawl out. Any pain at all?
No.
I mean, you've been wiggling around.
Karen checks the man for neck and spinal injuries.
Look right up that way for me. Any pain in your neck?
Despite the high-speed crash and the force of the impact, the man doesn't appear to have damaged his spine.
Do you think you're hurt anywhere?
No.
Excellent. You've got a little bit of blood on you. I'm not sure where that's come from.
As the man is bleeding from an unknown injury, the critical care team want to get him out so they can fully investigate.
He's saying that he's uninjured. He seems very well, so we're going to try to support him to crawl out the back.
Yeah, that's fine.
Or hopefully all we need from you guys is just to steady the vehicle so that it's not going to kind of rock over as it goes.
That's pretty stable already now, so they shouldn't have any issues with that.
Cool.
Meanwhile, the driver seems to have other things on his mind.
Worrying about how am I going to get to work tomorrow?
Let's worry about that in a minute when we're not in the side of your car, eh? Keep coming.
Yeah.
Keep coming. Well done, fella.
Right, let's get out of there.
Watch your hand on the glass.
With the man out of the wreckage, he can be taken to hospital for a fuller assessment to make sure he hasn't sustained any life-threatening injuries.
Just got to get his...
There we go.
All right, fella. All right?
Yeah.
Better upright. Excellent. You can't, mate.
I know.
We're going to get you onto the ambulance so we can have a good look over you. No, we need to.
That's really kind of you to not want to bother anyone, but we'd much rather that we look you over because your cars are quite a smash. And you have got a couple of little scratches worth clearing up. You don't get infected, do you? You really do.
With the man out of the car, they are able to examine him for any serious injuries. But at present, he is refusing treatment.
I really don't want to cause a fight.
You've got a scratch on the back of your arm, quite a graze. If they can just give a clean up and a wipe over and get the bits, and you've got bits of glass on you as well. Yeah. So if you pop into the ambulance, they'll just be able to clean that up for you. Okay.
I didn't realise how bad that was.
He's acting quite strangely. In fact, he's desperately trying to act normally. There is a whiff of alcohol, and I suspect, given the story that he's got as well, that the tractor came out on him, and the tractor's on the right side of the road, that he's probably been drinking and swerved.
He's going down to the ambulance now. Minor injuries from what we initially see here. Yeah, could you please breathalyse him? Because we've all got suspicions.
His personal belongings, he's got vodka in his bag and a hip flask. Do you want that left there or not?
Yeah, you can do. I just spoke to a lady who said he was sweeping. It looked like he was having some sort of medical episode.
He's been drinking.
So the vehicle was just zigzagging across the road. I just saw the big cloud puff, and obviously he hit that, flipped over.
Other road users witnessed the man driving erratically.
I pulled straight over as I was the second or third vehicle, just to check to see if he was all right, if there's anything I could do for him. So, and just kept talking to him really until the ambulance services turned up. Could have been far worse.
In the back of the ambulance, the driver is breathalyzed by the police.
What more do you need from me?
I just need a specimen of your breath. Are you happy to provide me with a specimen of your breath?
Yes.
You are. I'll get you to do a long, continuous, until I say stop, and blow. Keep going, keep going, keep going, keep going, keep going. That's it, thank you. That's it. So at this moment in time, I'm arresting you on suspicion of drink driving, okay? You do not have to say anything.
He's tested positive.
Knew it. What did he blow?
132.
And what's the pass? Or fail?
35.
Wow.
It's very lucky he didn't cause something worse, isn't he?
In England, the legal limit is 35 micrograms of alcohol in 100 millilitres of breath. The man recorded 132, more than 3 times over the limit.
Apart from a few cuts and
bruises, nothing life changing, nothing life threatening, so we can organise recovery and get that sorted.
Yeah.
The driver is left with the ambulance crew to be transported to hospital. Karen and Hannah head back to base, ready for their next emergency.
All clear right, and we're clear to the left, and lifting 1907.
Well, he was a very lucky chap, wasn't he? He was. Very fortunate there were no serious injuries.
Ambulance services to patient, breathe in.
He's collapsed, love. I can't get him out.
Is he breathing?
He's on the floor, he's on the floor. He's on the floor and he's...
I need to know if he's breathing.
He's breathing, yes.
But he's not away. Has he been injured?
Yes, he's dead. Oh, he can't get his breath. Okay.
An ambulance crew is already on scene. Now the critical care team have been dispatched.
The first two were like 3 minutes from call time to arrive on scene, and then called for backup. I think they probably found them in cardiac arrest.
Critical care paramedic Steve Mitchell and paramedic Ben Reen are 12 minutes out from the scene.
Was this gentleman found in cardiac arrest or was it witnessed?
Really unsure on that one. I just spoken to the second crew who are arriving now, and then they'll try and get us an update on exactly what's going on.
During a cardiac arrest, the heart stops beating, leaving critical organs starved of oxygen. As this man's life is hanging in the balance, the critical care team need to urgently get to the scene.
So the crew have got on scene and requested backup straight away because he's in cardiac arrest. There's a second crew about to get on scene and get into their level 3 PPE so they can start managing the airway correctly.
2 ambulance crews are now at the address and battling to keep the patient alive.
We don't know who's called us, how he's been found. We've got no age, head injury, query head injury, so don't know.
When the body is deprived of circulating blood, the risk of a catastrophic brain injury increases dramatically. With each minute of a cardiac arrest, the chances of survival fall by 10 to 15%.
The crew have stated this is now a ROSC and they have requested your attendance.
Fantastic.
Again, no other information, 57-year-old.
The first crew and the second crew have managed to get a ROSC, so that's a return of spontaneous circulation. So the patient's heart is now beating for itself.
Even though the ambulance crew have managed to start the man's heart, he could arrest again at any moment.
So now is a really crucial point for this patient. You've got to be very careful with him, he's very unstable.
With the added risk of a potential head trauma to contend with, the skills and timing of the critical care team are going to be needed.
Now how are we going to do whether we do it with a bandage?
In Bartley Green, Dr. Matt Rowley and critical care paramedic Kerry Penn Ashman are treating 62-year-old Terry, who has fallen downstairs and hit his head.
That is quite bleedy, isn't it?
Terry has been bleeding profusely from his head wound, and the crew needs to assess whether he's suffered any serious trauma to the brain or an arterial bleed.
Pop your pad on. I think what we'll try and do is if we get him out of it and then roll him on his side, and then we can have a little look then.
Right, so what we're going to do, mate, is we're going to roll you onto your side so that these guys can have a good look at your head and see exactly what's going on.
Okay.
All right, and we're going to roll. Ready? 1, 2, 3, roll.
The head, and in particular the scalp, is a very vascular area of the body. If an artery has been severed, then Terry could lose a lot of blood very quickly.
Keep your head still for us, Terry, just whilst these guys have a good look.
I just put a big dressing on that, I think. It's not arterial, I think, you know, we're just going to cause more damage than good doing anything.
To find the blood is not from a damaged artery, the team start prepping Terry so they can get him to hospital for further assessment.
I think blue gauze dressing that you had before.
Yeah.
Just with bandage.
And then bandage round.
Right, Terry, so we're going to basically slide you on the floor so that your head's sort of pointing out towards the door, okay? Put you on our little board.
Matt decides it's safer to support and cover the head wound and get Terry to hospital, rather than deliver a significant intervention on scene. But first, they need to manoeuvre him onto the scoop.
All right, you ready? Okay. Good man, that's it.
That's it. I've got your legs. Do a bit of acrobatics.
All right, honey.
Start to straighten your legs up for us. Nice and straight, that's it.
Push your head down against my hands now. So.
Ready.
Steady.
Steady. Fine. Okay, stop. If there you go, sweetie.
Right, yeah, that's...
Nice and relaxed for me, mate. Okay, just for a minute.
I'm just going to grab your waist, hun, okay?
Okay. Yeah.
Sorry.
Just keep your legs nice and straight for me, Terry, all right, mate?
Okay.
Once on the scoop, the crew cover the wound with a pressure bandage to help reduce further blood loss.
Push your head down against my hands now. So.
Right, I'm going to try and put this quite tight.
Yeah.
So I do apologise.
That's all right.
If I have to say so myself, that is blooming neat bandaging. Just keep your hands on your tummy, darling. That's still saturated. And he's on. Can you just go onto your side a little bit, just so I can...
He's got a large laceration to the back of his head after he's fallen down the stairs, so he's got a significant amount of bleeding in the back of the head. The scalp is very vascular,
and sometimes just a few drops of blood can look like a significant volume on the floor. So he's stable at the moment. He needs to go to hospital to have it washed and examined and sutured up.
I'll speak to the trauma desk and we'll just let the QE know because they need to see him sooner rather than later, all right? Just keep your head still, honey.
Okay.
You ready?
Yeah.
Ready, steady, lift. Just watch the pool of blood and don't slip. I'm absolutely covered in blood.
Although there's still a concern for the amount of blood that Terry has lost, he's stable enough for the ambulance crew to take him to hospital.
We'll speak to the trauma desk and just let them know, and then we will tell the QE. You okay? I think we need to tell them because they need to see it sooner rather than later, because like you say, it's just constant.
How are we doing, mate? Yeah? We're just going to wire you back up to our machine.
I'm just
and
covered.
do all the checks again.
On board the ambulance, Terry will be carefully monitored.
So 126 over 90, a little bit tacky at 114.
Are you in any pain at all at the moment, Terry?
My head's obviously sore wet smatters.
Yeah.
But apart from that, no, I'm alright.
How bad's the pain in your head at the moment, if you had to score out of 10?
Stinging. Is it bad?
You got a bump and you've obviously nicked something because it's continuously bleeding. So we need to get you to the hospital so they can have a look at it and maybe just pop a little suture in it just to stop it bleeding. All right, but we'll get you going soon. Thanks, guys. I just closed one of these doors up. Take it easy. Lovely to meet you. See you soon.
Well, pretty much on top of it, I guess dynamic risk assessment wise, we can try and do a drive-by and update with anything pertinent.
In Birmingham, critical care paramedic Dan Fletcher and Dr. Matthew Newport are on their way to the scene of a reported stabbing.
Are you standing by, over?
It's unknown if the attacker is still at the property, so the critical care team have had to hold back until police arrive.
9-8, we got visual with police who would look like they're on scene.
Reached your destination.
You alright?
Yes, all the back there.
Now safe to enter the property, Dan and Matthew are backed up with police and an ambulance crew. With reports of heavy blood loss, they want to get to the patient as quickly as possible.
Do you mind just clearing out? Yeah, thanks.
I don't know what.
Thank you very much. What's that been done with? Is it glass?
I don't know. I got dents onto my back.
Looks like glass, which is fine. At least it's sharp.
Right.
Yeah. That'll be fun. Right, hang fire. Right, back with you in a sec.
Yeah.
How old are you? 22.
Despite the initial reports, the 22-year-old man hasn't been stabbed. It appears he was punched and fell back onto a bottle, which has caused a deep wound in his back.
A couple of fellas here, I don't really know them. They were, kicking off, we were all trying to calm it down. His mate was even trying to calm it down. And I said, look mate, you need to go. And he's definitely straight up to my back.
You've got a relatively superficial, sort of shallow wound, but it is going through to fat layer underneath. So because it's penetrating and because it's in an area that potentially there's some blood vessels, and the fact that we're literally a stone's throw from the QE hospital, we'll just take you around there. We'll get into the back of the ambulance, get you warm. I'll do a quick top to toe.
Matt has spotted fragments of glass in the wound.
This is a washout and explore. It's just this glass here.
You might have walked around.
Pal, shall we take you towards the ambulance where it's warmer, yeah?
Because you're so good, we're going to walk you. It's going to be fastest.
Yeah,
You're right.
Alright, it's nothing for you. I'm not.
Come on. No press ups. Up, keep going. Well done.
Right? Yeah, it's just
hold on to me.
Yeah, I'm alright.
Because the 999 call reported a stabbing, police, ambulance and the critical care team were all dispatched to the scene.
Wow, there's fucking loads of you.
I know, buddy. Because someone's still doing the stab.
Oh no, that's it, mate. You can't get enough of me, can you?
When they get the man to the ambulance, it's clear he doesn't realise what a lucky escape he's had.
Just stand still a second. Just get a nightingale dressing. Just going to put a dressing on him, pal, alright?
Honestly, I'm sorry.
I know, but we don't.
You are sound. Someone's just going to need to wash that out and see how deep it goes.
Will one of you do me a favour and take a picture of it?
The glass from the bottle wound will need to be washed out to prevent an infection. So Matthew protects the cut until that can be done.
So what we'll do is I'm just going to put a little bit of padding on it, seal it over, we'll lie you on your front, I'll put a drip in, we'll get some monitoring on and we'll literally drive you the 4 minutes to hospital. All right.
Thank you very much.
Just lean forward on that so you can press a little bit. There's like a Wicked bottle or something.
What?
It's like a WKD bottle or something, yeah.
See, I didn't know what happened when it happened.
Yeah.
I genuinely didn't feel it. I just put my hand on my back and it felt a bit moist. See, I put my hand in there and was like, fuck. And I was like, so I lay down and was like, look, mate, what's going on with my back?
As Dan finishes applying dressing to the bottle wound, he updates control.
22-year-old male, just prior to time of call, is being glassed in the lower back with a bottle. He has a 2-inch deep lac/puncture wound to his lower lumbar spine, like just paraspinally, and no other obvious injuries.
Stab wounds, knife, glass or otherwise, they're really difficult to sort of ascertain how deep it's gone, and it could easily have gone through damaged major blood vessels. Right, here we are then. It was bleeding a reasonable amount, but did need a lot of intervention from us. I guess he's been lucky in that regard.
Have you got a Sharpie?
Sharpie, yeah.
Stick my name on it.
It's the start of a 12-hour night shift for critical care paramedic Rich Apps and Dr. Luke Banks.
That is terribly written. It's like a schoolchild's written it.
Every shift brings new challenges for the critical care team, and there's no such thing as a typical day.
I was in the control room last night and it was absolutely manic from an ambulance service numbers point of view. It was really busy, but Tuesdays generally it can be quite quiet, but you never know.
Hi Rambo, calling from police, requesting your attendance to a log if we could. Yeah, not a problem. What's the address we're coming to, please? It's the bridge in Hereford. Okay, and what's happened there, please? So we've had a call from a member of the public, at least stating there was a male on the wrong side of the bridge. They think the male has actually gone into the water. He looks like he's taken his shoes off. He's left some shoes and an empty bottle of vodka on top. Oh, right. And the caller's pretty confident he's gone in.
A 999 call like this means all the emergency services have a critical role to play.
Yeah, 5-5, with some further updates. The Fire Brigade have also got a drone arriving with about 5 minutes, which is up, what's up?
Police and fire are on their way to the incident, bringing specialist kit to search for the missing man. An ambulance crew is also on scene, and Dr. Luke and critical care paramedic Rich have been called for their advanced life-saving skills.
If the patient has drowned, then there would have been a period of hypoxia or no oxygen going to the brain. And so if the patient is found, then we've got to do everything we can to, optimise the chances of a good outcome. And that will be to principally protect the brain, ensure adequate oxygenation and adequate blood supply.
After a 45-minute blue light run, Luke and Rich arrive on scene.
That's the road there, isn't it?
That's the road.
It's there in the water there.
It is a large-scale joint operation with police, fire, ambulance crews and search and rescue teams out on the water.
We've arrived midway through a multi-agency meeting, so we allow that to finish and then we're going to catch up with the incident commander. So obviously they're still searching for the patient at the moment.
It's 4 o'clock in the morning when Rich and Luke are briefed by the operations manager coordinating the search.
Credible witness, reliable, we've seen. Stripped off on that bridge there, 2:30, jumped and went straight into the water. The search has been done by FRS, 2 boats in the water. Yeah. They've got choke points, all the good stuff. They've got a night drone coming down. They've got the dog.
We are going to move the crew to Hereford Rowing Club. That is, if we do recover anyone, that is where we will obviously recover the individual too.
Rich and Luke are redeployed to where the search team will rendezvous if the man can be found.
We're going for another, well, probably 25 minutes from now, before they're going to make the decision if it'll be recovery then. Obviously, if they do find anyone, there'll be a couple of minutes before they get down, so I don't know if we just have everything ready that we can just whiz everything down on the stretcher.
Yeah.
So what time is it now?
It's 20
past, and we think he went in at 2:30.
Yeah.
So it's near coming up to 2 hours now.
As the search continues, Luke and Rich can do little but wait at the incident HQ.
The longer the patient isn't found, unfortunately the chances of a good outcome are narrowing. I'm cold, so I don't know what the temperature of the water is, but it's going to be cold in there.
It sounds like he was intoxicated as well before he went in the river, so the likelihood of him being able to hold his head above the water and not take on board lots of water is slim, isn't it?
So he's got IV access in his right arm, yeah?
Left, unsuccessful.
In Darlaston, critical care paramedic Steve Mitchell and paramedic Ben Reen have just arrived at the location of a man who has suffered a cardiac arrest.
My only thought at the moment is just the airway.
He's okay, lying on his side.
Fine.
57-year-old Ian is a full-time carer for his mother. Whilst playing with his dog, he suffered a cardiac arrest. His sister made the 999 call. The ambulance paramedic updates Mitch.
When we arrived at the scene, we found the patient on his knees, slumped forward. He had got some trauma to the head, small head injury, but no palpable pulse present.
It sounds like he's probably had a cardiac arrest, fallen forwards, banged his head. Would you agree?
Yeah.
Every second counts. In the UK, just 1 in 10 people survive an out-of-hospital cardiac arrest. Fortunately, the ambulance crew were on scene in 3 minutes and have managed to get Ian's heart pumping again.
We'll put him back on his side if you're happy with that. Yeah. So guys, put him back on his side. Okay. And put a pillow underneath his head. I think as is, get him on the trolley, off to the back of the ambulance, off we go.
Blood pressure 103/69.
Yeah.
Mitch.
Okay. So what we can actually do is start reducing his O2.
Although Ian's heart is beating, he's not getting enough oxygen to his brain. It's leaving him restless and confused.
So the idea of putting him on his side is that he's not trauma-related. Well, we don't think it's significant trauma to his neck. If you lie him on his back, as you can see, he's starting to get a little bit agitated.
Ben and Mitch now need to make sure whatever caused the cardiac arrest doesn't happen again. They suspect an occlusion or blockage of a coronary artery, which is a vessel which supplies blood to the heart.
So his heart's still beating for himself, which is good. It looks like he's had some sort of heart attack. There's some changes on his ECG, so still breathing for himself, heart's still beating. So we're going to just carefully move him down to the hospital now, and hopefully they can intervene and sort of stop that occlusion. He's starting to talk and sort of come around a bit, which is a good result.
As Mitch and the ambulance crew manage Ian's airways.
Hi there. Has anyone had a chat to you yet? No. What relation are you or sister?
Ben speaks with Ian's relatives.
It looks like he's had a bit of a heart attack, and that's what's caused him to go into this cardiac arrest. The guys did an awesome job. They got his heart going back again on his own. He's breathing for himself, which he's doing really well. With anyone that's had a cardiac arrest, the risk is the lack of oxygen to the brain, and it's how much time has been down with that lack of oxygen, which can make quite a big difference. So by no means we're out of the woods.
Mitch and the paramedic teams need to get Ian off the floor, onto a stretcher and straight to hospital.
So, on your call, Craig.
Okay, ready, steady, lift.
Okay. Feet first, yeah.
Fair play. Watch your step.
Okay, yeah. Let's go have a chat with the family, alright? And then what we'll do is we'll take him off the scoop once we're in the back of the ambulance, alright? 6'2". Yeah, can you pass an alert to New Cross, 57-year-old male, perceived to be a cardiac arrest, fallen, then banged head, but doesn't appear to have any significant trauma to his head.
As he's still critically ill, Mitch will travel with Ian to New Cross Hospital in case he has another cardiac arrest.
Ian, it's the ambulance. Can you...
Well spotted.
Cool.
Ready to go, yeah?
Happy? It looks like he's had a stroke as well.
Yeah.
Do you think so?
We were
Do you know
concerned
if
about
there's a-
that because he was on his knees.
Could you ask the family, see if there is any sign of stroke in the family? Previous stroke. History of stroke, yeah, thank you.
Ian is agitated. This could be due to a lack of oxygen reaching his brain while he was having a cardiac arrest. He urgently needs assessment at hospital.
Just really nice and smooth. So if he does arrest again, guys, it's like 3 stack shocks, but what we'll do is, whilst it's charging, we'll try and do a bit of CPR.
Mitch plans for every eventuality on the journey to hospital.
It's some midazolam. Sometimes what you find, once they've had a bit of a snooze and you let them like settle, they'll like, it just like resets them.
Although Ian is breathing for himself, he's still confused and disorientated. So Mitch gives him a sedative called midazolam, a drug used to help sedation as he continues to breathe for himself again.
Once they've had a bit of a rest, they're like a bit more settled when they wake up. It's nice and steady.
50 minutes after the 999 call, Ian is handed over to the cardiac team at New Cross Hospital.
The situation he was in was life-threatening. He was in effect dead. So the crew have applied a defibrillator, they've shocked him, and that's their sort of key chain of survival that they've done. Obviously he's had his brain starved of oxygen for a short amount of time. Hopefully it won't be too detrimental to his outcome.
Go ahead.
998, are you allocated with the courier?
Yeah, that's affirmative.
In Hereford, critical care paramedic Rich Apps and Dr. Luke Banks are on standby to treat a man who is believed to have jumped into a river. But his chances of survival are diminishing by the minute.
We've just had another update saying that they're just completing the final bank searches. Obviously it's getting a bit lighter now as well, and if they don't find anything now in the next couple of minutes, then all the ambulance service resources will be stood down and it will become a body retrieval recovery, unfortunately.
It's now 2.5 hours since the 999 call.
So I've just had the final stand down for us from the tactical incident commander, so they're calling off the search. He said that we can stand down and return to base.
In 2019, there were nearly 6,000 suicides in England and Wales. 3/4 of them were men.
Sadly, it's turning into a body retrieval, body recovery, so sad case, unfortunately.